We and others have shown that actually in the last 10 years, in contrast to a decline of stroke incidence, that's new stroke cases every year at old ages, there has been a doubling of stroke incidence at younger ages, and we don't really know why this is happening. Now, this could have huge impact in the future, not just for the individuals, but also for the society, given the potentially increased risk of dementia, mental health illness, and also lost years to work. So that's why I think there really is urgent need to really understand why this is happening and also to manage young strokes better. There are, for strokes at all ages, there are 3 types of risk factors. Traditional risk factors, so these are high blood pressure, diabetes, obesity, smoking, high cholesterol levels, and sort of more emerging risk factors. So these are things like less physical activity, long working hours, depression, anxiety, stress, and also some slightly rare etiologies or risk factors. So they are rare in general, but slightly more common at younger ages. Really, we're interested in understanding or improving prevention and management of stroke at younger ages. So in order to do that, we decided to do it in 2 different cohorts. So the first one is a standard population-based study in Oxfordshire, and that's led by Professor Peter Rothwell in Oxford, and that's called the Oxford Vascular Study, or OXVASC. The advantage of using OXVASC is that it has near complete ascertainment of all stroke cases. So I'm able to look at sort of the changes in stroke incidence at younger ages, the risk factor changes more reliably. The other cohort that I actually set up and we're currently running is a regional cohort study that's called the Thames Valley Young Stroke Study. The advantage of the Thames Valley Young Stroke Study is that it's a fully phenotyped cohort. So all of our patients have got not just standard investigation, but more detailed imaging of their vessels, of their heart, of their brain. And we've also collected a rich resources of biosamples as well. So with the Thames Valley Young Stroke Study, we're hoping to look at emerging risk factors, some novel or underdiagnosed etiologies really. Any young individuals, it's important to recognize that if someone has a sudden onset of stroke-like symptoms, it's really important to seek urgent medical attention. It's not just to reassure yourself, because I'm young, this is not going to be a stroke, then I can just wait and see if it disappears. It's really important to seek medical attention if anything unusual happens all of a sudden. Also the same for sort of healthcare professionals. You know, it's important to recognize that there is an increase in young people having stroke. So when you are faced with or presented with a young person with stroke-like symptoms, do think about stroke, because delaying treatment can cause quite huge consequence to that individual. So the foundation funding has been really important, without which I would not have even started this fantastic research journey in this area. So I'm really grateful for the opportunity and for all the support that the foundation has been giving me in the last 3 years.